Happy New Year! It is an exciting time to be alive, to be here. We have made it through 2023 and now it is 2024 and it is time to get busy doing what we have been saying we're going to do. Everybody has the New Year's resolutions, but seriously, this year we are about business. And we started off the year, first of all, being thankful. We are all very blessed. There are some people who didn't make it to this year, so we want to actually get the best out of our life, the best out of our journey, and we are excited about this new and upcoming year, even though it's snowing and cold in Chicago. It's okay because we haven't had a bad winter so far, so we're going to keep it moving. And we are starting off the month with what everybody talks about. I got to lose weight. I got to be better. I'm going to do this better. So we're going to help you be that best person that you are. So this month, we are talking about a better you. And I mean a total better you. And that's starting inside, outside, mental health. All of those things are going to be a part of this. We today are going to talk about more of body sculpting, about weight loss, about lifestyle change, because we got to start somewhere. So we might as well start in January at the beginning of the year, and we're going to continue this whole process. We're going to push you forward. The staff and I are working on being better in our lives as well. So you'll see transformations. We want you to make the transformations with us. So let's get started. We are going to talk about, once again, body sculpting. Now, one thing I tell people with body sculpting, anybody who comes and does a consultation, this is not weight loss. So if your goal is weight loss, then focus on weight loss. Now, my big thing, we do weight loss, we do medications, we do education, we do the injections, we do it all. But my goal is not for you just to lose weight. It is for you to actually change your lifestyle. If you're going into this year talking about, well, I'm a diet, that diet's going to last you for a couple months, and then next year we're going to be at the same, talking about, I got to go back on that diet. No, we need to change a lifestyle. We need to change a mindset. So we're letting people know we do a lot of the weight loss, we do a lot of the body sculpting, but once again, it is your total well-being. That includes, we talk about stress, we talk about exercise, we talk about all those things because this is all encompassing. Sleeping, lots of changes are happening, especially as we get older. I'm not going to tell you I'm going to have a special birthday this year, but you all don't need to know what my age is going to be, but it'll be up there. And so I'm still trying to hang. I don't need to look the age that I am. So we have to do things to maintain that. One of the first things I tell people, a lot of people have asked, they've called, yes, we do injections, we do pills, we do weight loss management. So when I'm talking to people, I'm talking about lifestyle changes. I'm not talking about you just coming to get a shot and then you go home and eat Burger King. That's not good. You'll lose the weight, but will you keep it off? Not unless you change something. So once again, we are about teaching you, showing you how to be a better version of yourself. These are just some of the things that we use. So these are one of the pills that we offer. It is a pill that you have to take every day, so it does have a small amount of phentermine. This is for my patients who eat when they're stressed. So it has a little bit of medication in there that actually helps decrease those urges. So it decreases the appetite. So this is a pill that we do. There's another one called Casimia. So this is the one that we have. And like I said, you can always come in and do a consultation. We're actually doing $50 off all of the weight loss consultations this month. This is Wegovy. This is one of the injections. There's another one that just came out in November that's called Zepbound. These are weight loss injections that you do once a week. Once again, These are not miracle medications. This is meant to be used as a tool to actually help you change your lifestyle. It takes 21 days to make a habit. So this is going to actually help you change that habit. Um, so those are more for weight loss. Now, once you've kind of gotten to a stage where you're like, okay, losing the weight, I still want to sculpt my body. Now, we're going to talk about cool sculpting, which is, it actually removes fat cells. So we'll talk about how to do that. We're going to talk about skin tightening, because once you lose the weight, we want to make sure that you just don't have a lot of sagging skin, which is the other thing we talk about with weight. Increase your protein while you are trying to lose weight, because you don't want to have a lot of sagging skin. And then we talk about building your muscle. This is the M-Sculpt. So the M-Sculpt will actually help build your muscles. So let's start with getting rid of the fat first. Now, what I tell people with cool sculpting, like, well, how does it work? How it works is, this is a device that actually freezes about 20 to 25% of fat cells. People ask me, do they come back? No, those fat cells get processed through your liver, excreted out of your body. The process for this takes anywhere from 8 to 12 weeks. Now, it is not going to, this is not liposuction. This is non-invasive. You come in, you go home, and like usually the procedures take about 30 minutes to an hour depending on the areas that you're doing. But this is going to remove fat. Now, if you have an excess amount in a certain area that you want done, will it reduce it? It will reduce it, but it may not reduce it to the point where that's what you're looking for. And that's why we always do in-person consultations, and we can do them by video as well. But we do that so that you're getting what you're looking for. This is not liposuction. I do liposuction, and this is actual liposuction, which we can sculpt the body more. And even liposuction is not a weight loss procedure. It is strictly body sculpting an area that you are unsatisfied with. So what I tell people with cool sculpting, results take around 8 to 12 weeks for that to occur. It's non-invasive, so you can have it on your lunch break and go back to work. Nobody is the wiser. That's between you and your technician. So this works well. It's going to remove about 20 to 25%. Some people will need to have 2 sessions depending on the volume that you are doing. What area can we remove with cool sculpting? If you can pinch it, we can get rid of the fat. So we do a lot of the chins. We do the arms. We do the abdomen. We do the saddlebags, on the side. You can do your bra fat. So there's the inner thighs, lots of areas that we can treat with cool sculpting. And once again, it's non-invasive. So this is the fat removal. This is BTL Exilis. This is skin tightening, and you can tighten any area on the body. So you can do the eyes. If you go to our website and look on our gallery, you can see all the pictures that we have, and these are our clients. You can do the eyes, you can do the face, you can do the neck, you can do the arms, you can do the inner and outer thigh. I also use this device for vaginal rejuvenation, and that helps with tightening the vagina, also helps with bladder issues. It's all non-invasive. This is radio frequency. So one thing I tell people with radio frequency, you have to be hydrated, and it depends on certain areas that we're treating. You can't have metal in those areas. So if you have a metal or a copper IUD, well, you can't do vaginal rejuvenation and you can't do your abdomen, because that metal can cause discomfort. You could do your chin, you could do your eyes. It just has to be far enough away that you can actually be treated with this. But once again, it will do any area on the body. You have to be hydrated with this device. So the reason I tell people that is that if your cells are dehydrated, then you're going to feel the heat a lot quicker. And we want to be able to take you up to the maximum temperature with this device. and give you the tightness that you're actually looking for. Okay, so this is skin tightening. Now we get to the muscle. Well, if we can't see the muscle, we can't really define it as well. So you got to start with trying to get rid of some of the fat. And these are just some of the devices to actually help you do that. But this is going to build your muscle. And I tell people, one session, so these are the paddles. This is a paddle. We actually put it on the abdomen, and it actually causes those muscles to contract. And this is going to be equivalent to doing about 20,000 sit-ups per session. How many sessions do you need? Generally, it is 6 sessions at 30 minutes. On occasion, we will make an exception and do, if you just don't have the time, we will do 45 minutes for 4 sessions. But once again, it's equivalent to doing 20,000 sit-ups. I don't know how many people are doing 20,000 sit-ups a day. I can't, even if I wanted to, but this is what this device does. The plus with this device is that it will also do lifting of the buttocks. So it is causing, so it firms up, so you're starting to get a little sag in the back. This device will actually help to tone those gluteal muscles, and it's going to cause them to give you more of a lift. Same amount of time, same amount of sessions, but that's equivalent to doing 20,000 squats. I can barely do 50. So each session is going to give you that amount. So you'll definitely feel it. It's not something that is not tolerable. It's a weird sensation, but it also, the device is meant so you don't have a lot of soreness afterwards. You know, when you do your sit-ups, you're sore the next day. Well, this device has included in it where it does some tapping that actually gets rid of the lactic acid, so you're not as sore the next day from doing what would be equivalent to 20,000 sit-ups. So, lose fat, tighten skin, and then build your muscle. This is just my little demonstration I show people. This is 5 pounds of fat. When you lift it, if you come in and you lift this, it's heavy. And so just imagine you just lose 5 pounds, what it does for your joints. And so 10 pounds is a huge deal. When you get into 30, 50 pounds, and we've had so many of our clients have so much success with lifestyle changes. We have a whole fitness center. Miss Rada has How About It Fitness. And when I say they are excellent, because I go twice a week, I'm trying to get myself together too. You are coming out with a whole different, you feel better, your energy is better, balance is better, which for a lot of us as we start to get older, balance starts to change. The stretching, it's all a lot better. And we are trying to, once again, start 2024 off with a bang. Ms. Rada is actually doing, so once a month, she's going to be offering a free session. It's a training session, so you can actually come in, meet with her and her team, see what it is that you need, maybe sign up for some of the classes, some of the training sessions, but it is no cost to you. This month she's doing it on the 17th from 11:30 to 5:30. You do not need to schedule an appointment. Give yourself about 30 minutes to an hour. Come with your workout clothes or bring them with you. But it's a great session. We're about trying to make sure that we are living better. And that includes mental, physical, eating right, sleeping right. All of those things will change your lifestyle. And that's what our goal is. So, now that I've talked to you about all this, let's see what kind of questions you have.
Yes, on Instagram, Always Healthy Skin asked, Doc, what is the name of the pill you mentioned at the beginning of the session?
There's 2 that we use. There's other ones. So we use Contrave, Contrave, and the other one is called Qsymia, and it's Qsymia. This is what it is. That's one of them. I don't have the other one with me, but it's Kissimmee. So those are the pills that we use. They both have a small amount of phentermine in it. Um, they have a second ingredient in it so that we don't have to use as much of the phentermine, but you still get the same effect. Some people don't like sometimes some of the effect of the phentermine because it can make you kind of wiry, and overstimulated. Some people it doesn't bother. So this is actually an appetite suppressant, so it actually decreases those cravings. But before you do anything on this body sculpting weight loss journey, clean your house out. Take those cookies, those pies, because I understand. My kids just left and went back to school. It's a bunch of chips, it's cookies all over the house. I'm giving them away because at night I'm like, oh, that cookie's still downstairs. Let me go eat that. I mean, nobody else is going to eat it. Clean out your house. That's step number one. So, just little tips that we try to give, and we give lots of them, just so that it makes you feel better in the long run.
Another question was, which device is best for long-term results?
So, it depends on what you're looking for. This is going to remove the fat. Once those fat cells are gone, they're gone. They don't come back. However, if you gain 15, 20 pounds, you will, the fat cells that you have will expand or it will go somewhere else. So this is going to be permanent. The M-Scope, which is the muscle building, like any muscle, if you don't continue to, so this isn't meant to replace exercising. This is meant to actually improve core muscles, strengthen your gluteus muscles, which helps with, like, when you're going from sitting down on a chair and you can't barely get up, it's helping build those muscles. So this is used in conjunction with exercising, but it definitely will build your core muscles. We've had a lot of people who have low back pain, and I'm not saying this is going to cure your back pain, but sometimes when your core muscles are really, really weak, this actually will help build up your core muscles, which takes a lot of the stress off of your lower back. So this isn't, if you don't continue to do the things, it's a muscle. So like anything else, if you're not continuing to work the muscle, it goes back to what it was. And we do have maintenance programs for the M-Sculpt as well. The skin tightening, we are going to lose collagen. So my husband, I didn't like when he said it, but I would complain about my age, and he would say, well, you have two options. You're either going to get older or you don't. So I'm going to choose to just get older, but get older in a better way. So this is going to help rebuild your collagen. Anything that is going to help rebuild your collagen doesn't last forever. Each decade, we lose about 3 to 5% of our collagen. So we have to eat differently. We have to maintain, even doing things as simple as certain facials is helping to build collagen. This is going to tighten the skin. I do a little trick for people when they come in, but this also helps the elasticity because I would pull my neck and it would just stay in that same position. So this helps to stop that. so that the elasticity actually improves with this device as well. But once again, nothing is permanent. A facelift isn't permanent. You're going to continue to lose the collagen. These are things that just actually help to maintain that. And liposuction, once again, it is going to remove those cells. Those cells are gone. But if you gain weight, these are not weight loss procedures. It will come back. It may come in a different area, but it does come back. Thank you for that question.
Sure. We've got some things on YouTube, and some folks are looking on Facebook.
Okay.
Donna Falca says, good morning, Dr. Terry.
Hello, Donna.
Happy New
Happy
Year.
New Year.
And Alma West, who's on Facebook, says, great job, Dr. Terry.
Thank you.
We do have some more questions.
Okay.
And these were submitted a little bit earlier. This is regarding the liposuction.
Okay.
And the question is, what should a patient expect? For instance, will the patient be asleep? What is recommended prep for the procedure? How long does the procedure take? What is the downtime? So quite a few questions there.
So everybody's going to be different. We don't do so I do liposuction. We do it in our facility. So this is not, you don't have general anesthesia. I would say the majority of the people don't even remember having the procedure. We have music on, so whatever music you like, we'll turn that on. But how we do them in the office, first you come in, we get an assessment. Once again, in the office, there's only so much fat I can remove at one time, because then it starts to change, like your potassium and sodium and those type of things, and you have to be monitored. So I don't remove much more than like 3 liters, which is about almost maybe 7 pounds, 6 to 7 pounds in the office. And there's so many areas that we can do at one time. So what's the downtime? It depends on what you're getting done. I've had, so full disclosure, I have probably done probably 90% of the procedures that we offer. At some point or another, I did liposuction of my abdomen. I did not transfer anything. Actually, I did. I transferred it to my face, because you can use your use your fat as stem cells, which is it's better than actually fillers because it lasts longer. But anyway, I digress. Um, I did the liposuction procedure on a Saturday. I had a meeting on Monday that was all day. So everybody's different. I have some people who they needed a little bit more time because maybe their pain tolerance is different. Most people will not be on any pain medications probably after the first couple of days. Lymphatic massages are something that we encourage. It is not, it's not a requirement. It actually helps you recover a lot quicker. It helps the swelling. But how long it takes, depending on how much fat we're removing, the area that we're removing, are we transferring it to another area? Because fat is probably one of the better stem cells that actually help rejuvenate tissue. So it varies. And so that's why we have people come in to do a personal consultation. But this is all outpatient. You do have to have somebody stay with you for the first 24 hours because you don't remember. Like, really, we have laughing gas here. People are laughing, and I tell everybody before they start puffing on the laughing gas that whatever you say is like Vegas. It stays in here. We don't tell people. We don't videotape you. And so, no, it stays in here. But we haven't had anybody who has had a difficult time with doing it in office. Most of them are surprised how easy the procedure was.
What should clients do after the treatment?
So there's different protocols for different treatments. For
They were talking about the liposuction.
Oh, so that first day you're gonna go home and go to sleep, because really you don't really remember the first day. And we've had clients come like, I don't remember any of that, which is great. The first day is probably the most discomfort, and it's just because there's some swelling there, and that's why we encourage the lymphatic massages. But the first day you're just gonna rest. We give you pain medication, we give you all the things that you need to be at home, but it's really not a whole lot that you need to do. After the first day, we want you up, moving around. This is not something that you're going to go home and stay in the bed for a couple of weeks. No, we want you up, we want you moving around, and getting back to your normal. Extensive exercising, that's probably going to be about 4 weeks. But we want you walking, we want you ambulating. Most people have a couple days that they take off. It's not something that you need to be off work for weeks.
Doc, you were getting ready to talk about the other downtime too, so you may as well just do that as well as far as.
So none of these have downtimes. None of them. So the radio frequency, when you're doing the face, it almost feels like a warm massage. The Emscope, like I said, it's about 30 minutes, but people aren't so sore that they're just like, oh my God, it's actually better than when you actually do your own sit-ups. And CoolSculpting, you may have a little bit of tingling in the area. Some people can have a little bit of numbness just because it's kind of like shocked the nerves, but those sensations start to come back within like a couple days to weeks. So really, there is no downtime with any of these procedures, which is why people like them, because they don't have to take off work. They don't have to do anything. Like I said, people come on lunchtime, or they come on a Saturday, or they come in the evening and have it done. And you're still able to go to those soccer and basketball and baseball practices, and meet your kids there, because it doesn't take that long.
Additional questions? Tonette King Alexander says, good info. Is any of this covered by insurance?
It is not. Some of the weight loss medications can be covered. These are all considered cosmetic. Like I said, the weight loss medications, so the Wegovy, the Zepbound, which is the same as the Ozempic and the Mounjaro, which are diabetic medications, and there's a whole explanation behind all of that. Those can sometimes be covered by your insurance company. So those are things, if you have a question about it, and you can call the insurance company and see what your coverage is.
That's
Is that all?
That's all the questions we have.
Okay, excellent. So hopefully I have educated you on what these are, how they work. But once again, the ultimate goal is a lifestyle change. We want you all to live a better life. I want to live a better life. I don't want to be tired. I don't want to be out of breath tying my shoe. So, which was happening at a point, but I feel better. My energy is better. Take your vitamins. You need them, especially vitamin D, because it also helps with metabolism and it helps with your moods and energy. Those are things that we need. We just have to start taking better care of ourselves. One more question.
Tonette King Alexander says, do you have a payment plan?
So we have Care Credit, and we have another source that we use for clients. And so, and then sometimes we'll have specials on things. If you are not on our email or text list, if you want to join, you can just call us. They can add your information so that when we do have specials, you'll know about them. But we do have Care Credit. Questions?
Those are all the
Comments?
questions. I just wanted to pop up the phone number.
Yes. So, Allure Wellness Center. We are about taking care of your total wellness from head to toe. That includes mind, body, and soul. So, give us a call, 708-895-8497. And then come and see us at 7151 183rd Street in Tinley Park. We are here almost 6 days a week generally, but definitely we're here Tuesday through Saturday, some Mondays. So give us a call, come and see us. If you have questions, call us, send us messages on Messenger, on Facebook, Twitter, Instagram, all of the social media platforms. Okay, we're going to make this a good year. So come see us. We're looking forward to seeing you. Talk to you soon. Bye.